Welcome back to the Piscataway African American Seniors Club Black History Celebration, Black Health and Wellness. I am Sherlin Mears. On this edition, the journey continues, and well, let Lois take it from here.
My name is Lois Green, and today I have the pleasure of introducing to you Dr. Torian Easterling. Dr. Easterling serves as First Deputy Commissioner of the Department of Health and Mental Hygiene. Dr. Easterling has spent more than 6 years in a senior leadership role at the Health Department. Prior to serving as First Deputy Commissioner and Chief Equity Officer, Dr. Easterling served as Deputy Commissioner of the Center for Health, Equity, and Community Wellness at the New York City Department of Health and Mental Hygiene, where he oversaw programmatic work focused on reducing overall premature mortality and closing the racial gap on the top leading causes of preventable death. He also served as the Assistant Commissioner of the Department of Health, Bureau of Brooklyn Neighborhood Health, where he helped advance key programming to address pressing concerns, including maternal deaths and gun violence. Dr. Easterling is a community physician committed to health equity, social justice, and movement building to achieve the health outcomes that all people deserve, both locally and globally. Dr. Easterling has many degrees from various colleges and educational institutions, and he is also, I am proud to say, my cousin. Thank you so much, Dr. Easterling.
Hi, I'm Dr. Torian Easterling, First Deputy Commissioner and Chief Equity Officer at the New York City Health Department. During the month of February, we continue to bring attention to the need for accountability to address the health inequities that continue to overburden Blacks and other BIPOC communities. What we have seen here in New York City, we have seen cases and hospitalizations related to the current COVID-19 wave start to decrease. But I want to be clear that what we are seeing is that community transmission continues. So what we know to be true is that vaccines are the single most important tool that will protect ourselves, protect our loved ones in our communities. And I think what's particularly important during this month, as we acknowledge and honor Black health and wellness, is really to ground us in not only the data, but the steps to continue to take care of our loved ones, and as I mentioned, ourselves. What we saw during this pandemic is that Black and Latino residents were much more likely to be infected with COVID-19. We saw also that they were also more likely to be hospitalized once they were infected. And at the start of this pandemic, we saw that, particularly here in New York, Black and Latino New Yorkers were more than 2 to 3 times more likely to die from COVID-19. And so it's also been important during this time, but also during this pandemic, to talk about how, our response to COVID-19, our support for our communities must be grounded in equity. That's one, acknowledging that there have been harms, both historical and contemporary injustices in the medical establishment, but also in science. And so part of building trust, not only in the vaccines, but in all biomedical interventions, is really grounding us in restorative practices, grounding us in trust and building trustworthiness to government, making sure that we're equitably thinking about how those resources are going to be brought into the communities that have been hardest hit. But then leveraging the power of communities, that not only the voices that have been most impacted, but also really thinking about how we mobilize the multitude of actors, whether that are community-based organizations, faith-based organizations, community-based healthcare workers, all moving towards the common goal of improving health and addressing equity. And so what I also want to just make sure that I go back to is that we're not out of the woods yet. We are still seeing community-wide transmission. And it's real important that we continue to message the ways in which we can continue to be safe. So we know that being fully vaccinated and staying up to date with your vaccination with a booster is critical to preventing severe outcomes. So I just want to remind everyone, if you are eligible, get your booster shot today. What the data shows is that an additional dose of either Pfizer or the Moderna vaccine provides enhanced protection against both infection and disease related to Omicron. And what I don't want to also minimize, and which is also really important, is that we have to continue to mask up. Current data really shows how when we do all the things that we know will keep us safe, testing, vaccines, and masking will really continue to improve outcomes for all of us. So just as a reminder, get vaccinated, get boosted, wear your mask, protect yourself and your loved ones against COVID-19. Thank you for all that you do to protect yourselves, your family, and your community. I hope that you have a joyous celebration, celebrating the lives, the struggle, the beauty of all African people throughout the diaspora, particularly in this country. Thank you so much for the time.
Hello, I'm Joyce, and I'm honored to be here today because I have a special guest to introduce to the audience. This guest is a member of the Piscataway senior community, also a member of the Piscataway African American Seniors Club. Also, he's a former president of the African American Seniors Club. He's also an active member of the domestic violence team, an active member of the Cultural Arts Committee, the Health Advisory and Cultural Arts Commission. He's a former member of the River Road Rescue Squad, also the North Jersey Philharmonic Glee Club. I'm so pleased because we're dealing with health and wellness in the Black community, and our guest today has exceeded expectations. His name is Franklin LeRoy Gibson. The Piscataway community knows him as Leroy. Leroy is approaching his 100th year, and I am so pleased to have him here with us today. Leroy, welcome.
Thank you.
Okay.
Glad to be with you.
Leroy, this is health and wellness. I'd like to ask you, do you recall or do you know if you were born in a hospital or at home?
I think my twin sister and I were born at home.
Okay.
I have no facts and no reason to believe otherwise, because then I think just about every Black kid that was born at home. The doctor came, boom, that was it.
So you had a doctor who came to the house or a midwife, to your knowledge?
Well, they used to have what they call visiting nurse services, and visiting nurse would be your stand-in for the doctor if you got ill or something sort of like this. You could count on the visiting nurse service. There were no Black hospitals. I think the first Black hospital that I ever heard or knew was Harlem Hospital in New York. There was none in New Jersey that I knew of.
Absolutely, that's the one I remember also. Uh-huh. Folks, we're talking 1922, just to put things into perspective, is Leroy's birth year. So he's offering us a lot of insight on what was happening back then. Leroy, what other issues of health do you recall?
There are many. All the childhood diseases that you can think of now were there. Measles, scarlet fever, etc. Infantile paralysis was the biggest one that I can remember. Ostensibly, if you had infantile paralysis, you had to go to the institution or an organization. Tuberculosis was one of those. And I worked with tuberculosis later in life at Greystone Psychiatric. And I learned there that they had at one time had people almost sleeping outdoors at night, whatnot, so they could supposedly breathe more freely with the idea. But it's one of those things that happens.
Is that what led you into healthcare?
Maybe yes. I don't know. I think my parents wanted me, my mother in particular, wanted me to be a doctor, but I wasn't seeing that as my way of life. But it kept me alert and wary of it. I remember in junior high school, I took first aid classes, et cetera, whatnot, so that as an elective. And there was somebody that would teach you about bandaging, symptoms, et cetera, illnesses, how to take care of this, that, or the other. And it did make a difference in my thinking a lot. There was one hospital that in the Oranges that I used to be able to, that we could go to. And this is where a lot of things that happened for me did go. We went, and it was successful. Of course, they booted you out as soon as they could, but hey, one of those deals.
Okay. There was a time when hospital stay was longer, and today now you don't stay in a hospital very long. You're in and you're out.
I was, I think it was talking about childbirth. My son, when he was born, I think he was in the hospital nearly a week. Sunday, and I think as before the Saturday was over, he would be out of the hospital. But my granddaughter was born, and I think she was out 2 or 3 days.
Healthcare has changed dramatically.
Dramatically. Well, there's a lot of things that we did. For instance, when you had the scarlet fever and things, and the way you knew it was they had a person there, they put a sign up on the door, on the house. Scarlet fever, measles, etc. And people were required not to go there. Tuberculosis, you know how long it took them to get a handle on TB? Yeah. Infantile paralysis, they just recently had a shot for that, and that was prevalent. There's so many kids that, friends of mine, that died because of it. But
when you said they put a poster or paper on the door to let you know what disease that family had, was that like quarantine? Did everybody have to stay in?
Yes. People stayed in the houses. The children couldn't come out under any circumstance. And that just was one of those things. And you couldn't go in. There was no visiting like this. I wanted to go play. Nah, we didn't do that.
Were you allowed to go to work? You know, were the adults allowed to come out and work?
Adults were allowed to go to work, yes. Okay. But children, it was to protect them as much as anything else, to keep them from being exposed. Good that it did, because they later came up with inoculations that satisfied that particular train whatnot. You didn't have to, if you didn't get, for instance, to go to school now, public school especially, you have to have these shots. Just as they're trying to get shots for this virus now, you had to take shots to be able to associate with other people.
Leroy, let me change this topic for a moment. What keeps you going?
I don't know. It's just one of those things that I think you can't stop and be, how could I put it, sit down and do nothing. You retire. I don't think there's retirement mentioned in the Bible anywhere. You keep on doing until you can't do any more. When you can't do any more, then it's time to lay your head on a pillow, rejoice and be glad.
So you have any pointers to give folks other than to tell them to keep on doing?
I won't say points, et cetera, but not. It's got to be within the individual, I think, more than anything else. You don't retire to die, although many people have done this, or they wait till they retire, till they're so sick that they can't do much of anything else, and then they retire, and because of it, they pass out. But it used to be people retired sometimes, and 6 to 9 months later, within the year, they'd pass. Basically, not. But if you've got anything, if you can do, my say is do. Please do. And stop the BS about, oh, I'm tired. I remember an individual that was a friend of my wife's relative. He had a heart attack. He came home and got into bed. And we went to see him, and he was getting out of bed. He didn't get out of bed to come, maybe take a bath, wash up, and eat meals. Then he went back to bed. Just wait until the Lord come and take him. When I says, well, the Lord take him one of those days. But hey, what more could you have? This is a pat on the back to let you know I'm coming for you. Get yourself in order. Get things done. Get ready.
Do you see your health care provider regularly?
Yes. It was the one thing that I was upset about was the argument my wife and I had discussion we had. She had a health care benefit. Mine would die after I retired. I was out to get some more insurance. But she had insurance, and the insurance covered her. And being a teacher, she had an opportunity to get insurance that would last past what her retirement. So that's how we're in insurance now.
Okay, and so you see your provider regularly.
Yeah.
And I guess that's the question, is to see your health care provider, because many African American people particularly put it off.
Yes, we do. It is a big mistake, but what can I tell you? And people aren't so great about looking out for themselves as they should be. Years ago, we used to have the witch doctor, the midwife, and the person all over the area that would come and do and take care of some things for you. They don't know enough now. Midwives didn't know. Witch doctors didn't know that much. all of a sudden or whatnot, we have access to a whole lot more than we used to have. Everybody needs to take care and take, for instance, this virus that we're going through now. The doctors are telling us, and the healthcare facilities are telling us to be mindful of and take the shots, protect ourselves from whatever. We aren't doing it because we're scared. I will admit there were a lot of times, a lot of things that came about. For instance, the Tuskegee experiment, et cetera, and other things like this that we've undergone all our lives. All of the lives that preceded us have had this particular dilemma. But by people not wanting to treat it, working on to see what you can make of this. If we give this group of people this illness, how will it work? What can we do with it? We've gone through a hell of a lot with that, believe me. But we have to, I think, having to see it and do what we have to do for its benefit is something that we can't get around. It's a necessary thing to follow the right, but we can't always be positive of just what is right for us.
And I think trust plays a major part for many people.
Yes.
If I don't trust my government, if I don't trust my doctor, if I don't trust the healthcare provider, then I'm not going to do it.
That's right.
So I'm going to say that you trust your providers.
Yes.
When you meet them and they tell you of a condition, do you ask questions? Do you go prepared?
A little prepared, yes, because I have had a little experience. Some people say a little knowledge is a dangerous thing, but you learn not to stick your hands in the fire or not when they tell you get burnt.
I've heard that expression. I've heard that.
You get burnt. The idea is, more than anything else, don't be gullible, but learn. We can't learn. We have to teach each one of our offsprings when they're babies, not when they get to be 12 and 13. We have to begin preparing them at an early age so that, like my son says, you ain't finished school until you go, until you go to college. He was, 6, 7 years of age or something like that. These are the things that make the difference in what does and what doesn't become of our kids. I was in reading buddies here for a while, et cetera. There was so many people that are willing to teach, but they need instructions, and they don't get it. Our crisis with girls and domestic violence, et cetera, and like the nonsense that's coming out of Wall Township in New Jersey about abuse to kids, and et cetera, by kids, that was supported and continues. Children are not supposed to be waiting to learn about sex. They need to be prepared to know about sex and et cetera before they get to the spot where they have to be involved in it.
So let me say this, because I think LeRoy has offered us a lot, and he has much more to offer. We could sit here all day and have this conversation with LeRoy from both health to raising our children, to what's wrong with the world today, to how do we improve healthcare. I'm telling you, he's got some answers that information that folks could benefit from. But I want to thank LeRoy, and I want to thank his wife, his son, but most of all, the entire Piscataway family for just helping LeRoy, because it kept him vital, and he keeps up with all of his groups. And thank you, LeRoy.
You're welcome, hon. You are welcome. Anytime.
Okay.
All righty.
Hi, it's Diana Motley again, and I have another trivia question for you. Which states in the United States most likely did not expand Medicaid under the Affordable Care Act? Is it northern states or southern states? Okay, the choices are A, northern states, or B, southern states. All right, let's think about that one for a moment. Okay, the correct answer is B, southern states. Most of the states that did not accept Medicaid under the Affordable Care Act were located in the South. And this impacted many African Americans because many African Americans still live in the South. Thank you.
Hello. Thank you for tuning into our program today, and we look forward to seeing you next week.